I want to welcome everyone to the Middle Market Executive Forum. Thank you for attending. A little bit about the Middle Market Executive Forum. It's a series for executives and people who are very interested in what is going on in the community. It's generally our attendees generally consist of locally managed and mid-sized companies who want to learn something about what's going on in the region and hearing it from some of our most admired thought leaders in an informal and collegial setting. Let me just briefly tell you a bit about our sponsors. The program is sponsored by Coles & Thompson, Higginbottom & Associates, MarketWave, the Dallas Business Journal, and Capital One. My firm, Coles & Thompson, is a full-service law firm serving individual and businesses of all sizes. My practice is generally a business practice. Higginbottom & Associates, represented by Rob Causey, provides insurance, risk management, and financial services to its clients. MarketWave, represented by Tina and Michael Young, is a national integrated marketing communications firm focused on strategic marketing and PR programs. Capital One, represented by Rachel Capps, and though we may know Capital One is what's in your wallet, it's a full-service bank and more. And then there's the Dallas Business Journal, represented by Ollie Chaddock. Everything you want to know about business in North Texas and more, you can read about it in the Dallas Business Journal. And for a feature presentation, mental health in the workplace before, during, and after COVID-19. I'm proud to introduce our moderator, Vanessa Fernandez. Vanessa is a board member of the National Alliance of Mental Health Illness and chairs its National Strategic Alliance and Development Program. In the retail space, she leads sales, transformation, and people development as a district manager at Nordstrom's. Now, I got to tell you, I could keep on going on, but I'll leave it at that so we can get on with our program. Suffice to say, we are very fortunate that Vanessa is here and involved in our community. And without further ado, here's Vanessa to introduce our two other speakers and to kick it off. Thanks, Vanessa.
Thank you. Thanks, Bill. And thanks, everyone, for being here this afternoon. If you are here this afternoon with us, chances are you either know somebody or work with somebody that has been impacted by mental illness. After all, 1 in 5 Americans deal with some form of mental illness. That number has now been actually changed to 1 in 4 since COVID hit us. The numbers are staggering. We deal with co-workers in our busy workplaces, in our lives, that do tend to deal with the challenges of mental illnesses or issues related to self-care. And not every one of us is equipped to know the signs or know how to deal with it. And so today we're lucky to have 2 amazing speakers that are joining us that will share with us a little bit about what employers that they either work with or work for are doing to help their workforce as we all navigate through life, through COVID, through everything going on in our country, fear of isolation, working remotely, fear of getting sick of work, public transportation, parenting, caring for loved ones, job security, returning back to work. And so what we're going to do next is I'm going to have each of these speakers, our speakers, introduce themselves, talk a little bit about their companies and what they do in their spaces. And then we'll tee it off with a couple of questions for each of them. We will leave about 30 minutes for Q&A, so I encourage you to ask questions of these 2 speakers that have incredible amounts of knowledge and experience with this work. So first off, we have Angelique. I'm going to have you speak first. Tell us a little bit about yourself and your company.
Hi, I'm Angelique Morris. I work for Capital One, and I actually am an HR associate, specifically working in the talent acquisition space in my day job. Another role that I carry at Capital One is being the founder and national lead of Gray Matter, which is the mental health work stream under our disabilities resource group. This group was started in 2017 by myself And it was in connection to my own diagnosis with mental illness, and hoping to bridge the gap between finding resources and connecting to associates, as well as raising awareness and really putting mental health on the forefront for Capital One. Since then, we put on annual events during key months like Mental Health Awareness Month, as well as July, which is Minority Mental Health Awareness Month. We have since grown to be a thought partner with our benefits team. We are actually really engaging with some of our campus teams as well to ensure our campus associates are understanding how to care for their mental health on the onset of starting in the workforce. And so we also speak at various departments, and we're located across all of Capital One, which pretty much takes up most of the US. So it's a really large role to have side of desk in a sense, but it's very important work, and I'm super excited to be here and share not only that experience, but some of the learnings, and hopefully learn something today as well.
Thank you, Angelique. Athena?
My name is Athena Trenton. I'm the executive director of the local affiliate of the National Alliance on Mental Illness, NAMI North Texas. Our service area covers Collin, Denton, Rockwell, and Dallas counties. For those of you who have any relationships or association with the Fort Worth area, there is a NAMI Tarrant County. And their service area, they cover about 5 counties to the west of us. And NAMI North Texas, we are the grassroots, feet on the ground people who are out there to develop a community of support for people with mental health challenges, as well as their family members. We partner with many businesses in the area to help bolster their resources available to their employees, as well as provide classes, support groups, and other events during the year that help raise awareness and promote advocacy and just get that conversation started to try to reduce the stigma about mental health. So our primary goal is to keep people talking, start talking more about it, and hopefully at some point in time, we can talk about our mental health just as easily as we talk about our physical health.
Thank you, Athena. Okay, so I'm going to ask you guys a couple of questions now. So ladies and friends of the chamber, we all know that as employers, we all recognize that our workforce is a valuable resource. Over the last few years, I'm sure you guys have seen that employers of all sizes representing diverse industries are now beginning to focus on effectively addressing workplace mental health needs and solutions and benefits. This topic is no longer an afterthought, but almost a business imperative to business. And so to you, Angelique, my question is, what's the business case for employers supporting mental health and well-being of employees in the workplace?
Thank you. That's a good question. When I think of this question, I think in terms of not only the simple answer of just caring for your associates, but I understand that investing in and prioritizing mental health can seem costly, especially for smaller business. One thing that the data shows is that for every dollar that you actually put towards ensuring that there are resources available for people to take care of themselves and their mental health, you actually receive like a $5 return on that investment. Associates are less likely to take time off. They are less likely to, whether that's just calling in sick or using short-term disability, they're more likely to show up to work because they do feel that they can bring their whole selves, as well as there's a shift typically in the culture. So people are more inclined to be a little more open about what they may be experiencing, as well as the limitations in their roles that may be happening so they can get the help that they need. And all of that basically leads to associates coming to work and feeling better about themselves and also feeling supported. So for me, yes, the simple answer for an associate like me is I want to come to work and I want to do the very best job. And that is a lot easier when I know not only that there are tons of resources available to me, but that I can have open communication with my manager around what may be happening with me so that I can still show up to work and not feel like the only option I have is to say I can't work today, but rather being able to say today's not the greatest day, so I'm going to have a heads down day and here's spaces where I need help.
Athena, Dr. Trenton, I should say, did you have anything to add to that?
I think, gosh, Angelique covered a whole bunch of that. My approach is, to that question is, it creates a much more productive workforce as well. When you have happier, healthier employees, you have people who are more invested in their job, more invested in their team relationship with their coworkers, and you have people working together at a much higher level. So it's not just, using financial relationships with providing mental health and other physical health priorities, but it's also just taking a look at the team environment and the culture of the organization. I can tell you from my own experience, having to hide my own mental illness and being seen as being weak if I mentioned anything about it, and just saying, like Angelique mentioned, having a head down day, to be able to go to work and just say, I need a day where I can be a little bit less productive today, but I'm here and I want to be around my team, because that makes me feel better than sitting alone. Because the other piece of it is isolation is one of the worst things you can do when you have a mental illness. And that's part of what's happening with COVID right now. We're talking about before, during, and after COVID today. So before COVID, it was, gosh, I wish I'd really like to go to work and be around people so I'm not sitting here ruminating on my problems today, but I can't show my weakness. Now it's, okay, I'm stuck here, I'm alone, I want to be around people, but I can't. How do I try to create that environment around myself? And so during COVID, how can we create that team environment when we can't physically be together, but we can still develop those relationships with our coworkers? So trying to foster an environment such as that, and having those mental health check-ins. Mental health is just as important as physical health. It also can create physical problems and physical symptoms. So one thing I do recommend in relation to supporting your employees is to make sure that if you're leading a team, make sure you have at least once a week, you have a video call with everybody, not just phone calls. And the example that I can give you is, being able to read body language. When you're in person, you can read the body language and know the stuff that's coming out of somebody's mouth isn't always exactly how they're feeling, or you can tell that something's not right and maybe ask them afterwards, how can I help you? But if you're only on a phone call, you're hearing a voice in the background, you don't know what that body language is telling you. And a great example is one of my staff members. She's the person who is always, no matter what the situation is, she's the one who's coming in, cracking the jokes, throwing the sarcasm out there, and the most energetic and productive. And not long after we started having to meet remotely and meet over Zoom, she was still answering all of my questions. But she kept pulling her hoodie over her head and looking down and really only participating when she had to participate. And because of that body language, I knew to call her afterwards and ask if anything was going on. And I found out her cousin died from COVID, and she had been around him and she had a sore throat and she was very worried she had it. And so I wouldn't have known that. And that was really affecting her anxiety and her mental health because she was really afraid. And this was a time when we didn't know much about it yet. Luckily, she didn't have it. She's been perfectly healthy. But I think during COVID, it's really important to be very well aware that of the isolation that your employees are facing right now. And then the anxiety for those who have kids and are trying to homeschool or right now get them to sit in front of a computer for 7 hours.
Great tips, and thank you. Thanks for sharing that. On a personal note, I'll share with the audience. A few years ago, I needed mental health support to be able to support family members that were dealing with a wide range of mental illnesses in my house. And the truth is, I didn't know who I could go to for help in the workplace. And that's actually how I found organizations like NAMI, because not every human resources department, whether it is in a large organization or a small employer, has the bandwidth capacity or the live life experience to be able to support employees in a moment where they need some mental health or mental well-being support. So thank you, Athena, for touching on that. My next question for you guys, for Athena, actually, I'll ask you this question. What are some examples of benefits employers have introduced to support the well-being of employees since COVID-19? You touched a little bit on it by talking about virtual check-ins. What else have you heard out there in the marketplace in Dallas?
What I've noticed is that employers are calling us more often now to ask for approaches on how do they let their employees know that there are resources available. These were not resources that pre-COVID were promoted as much. And now that mental health is more and more on the forefront. And if you talk to a lot of mental health professionals, they're calling it the second pandemic, actually, just because of all of the isolation and the anxiety and the uncertainty that we're facing right now. It's unprecedented. And so employers are learning new ways to promote resources that they actually already have, but not many people took advantage of. They're promoting the telehealth aspect of it all as well. And then the other piece is, I think right now, because of telehealth and because most things are happening virtually, it's easier for people to reach out for help. An example I always get from the law enforcement agencies that we work with are that they don't want to use their EAP programs because you're walking down that hallway, you're going into that door, and your coworkers are seeing that and they're like, why is he or she going there? What's wrong? Will that person be able to cover me if we get in a situation that could be potentially dangerous and traumatic? And so there's all these things going on and that you're worried about what other people think of you, whether or not you're going to be able to keep your job just because you walk through that door. So, and that can happen in any workplace. If you have an in-house counselor that some larger companies do, a lot of people don't want to walk down that hallway. And so during COVID, creating opportunities for virtual check-ins with a professional. Some companies have even contracted with counselors at a reduced rate so that their employees can take advantage of mental health services through the company versus trying to seek it out on their own.
Great, thank you.
And then the other piece is partnering with organizations like NAMI, which they have affiliates all across the country, or state organizations or national, to collaborate on presentations such as this to employees. We've done several of those as well to raise awareness.
While you have the microphone or the stage, can I ask you to add to that? What kind of programs does NAMI offer? Either friends, family members? What kind of support do you offer?
So to start with just our general community level support, we have support groups and classes for family members as well as those people who are in recovery is what we call it. No matter what stage of recovery you're in, we call it Connections Peer Support. Those support groups have gone virtual. We have one a week for both, one for families, one for peers. Everybody in the group has lived experience, including the facilitators. They're great resources for support and for people who have been through the exact same thing you have, especially for family members who aren't quite sure what to do right now when it's not quite as easy to take someone to the hospital or get somebody, an appointment with a psychologist or a psychiatrist. Our classes, we have several different ones, but I'll focus on our peer and our family classes. These are for, the peer class is for people who are in recovery. It's an 8-week class where you learn about what's going on with your mental health, learning to accept it, address it, learn about it, why it's happening to you. Some people need to, understand why, and maybe that won't be an answer, but you find out that there's a community out there. And that's one of the main things we want people to know about NAMI, is that this is the non-judgmental community that you're looking for, that you can reach out to as the first place to go. And so you learn that in those classes. Same thing in the family classes. What they're learning is skills and resources to help their loved ones. What's a lot of times, most of the calls we get, especially right now, are from family members saying, I don't know what to do. How do I help my son? Especially adults who, you can't force an adult into treatment. So how do you help them? And these family classes and the family support group helps you work with other people in the exact same situation to find the resources, get the support. And we tell our family members, if you don't take care of yourself, how are you going to take care of your loved one who needs you right now? So focus on yourself, come to the family support group, take the family class. We also have some other on-demand classes for parents of children with mental illness and families of veterans. Those are all online through NAMI National. And then for local businesses, we can do customized speaking engagements. We kind of call it Mental Health NAMI 101. We can come in and we can tailor a discussion on mental health awareness, warning signs, coping mechanisms, resources. We can talk with you and design a program specifically for your company and the audience that would be there.
Thank you, Athena. Angelique, I'm going to bring it back to you and back to the original question. Examples of benefits employers are introducing to support the well-being of employees. Your company has been a thought leader and really a leader in this space as an employer, period, in the US. So tell us a little bit about how you are creating that inclusive workplace environment that allows employees to speak about this. Go ahead.
So Capital One, one of the things that everyone is taking advantage of is telehealth. I will say that that was something that was being widely promoted prior to COVID. And essentially, once COVID hit, not only was it to drive telehealth appointments, but we've also seen an influx of therapists, like my therapist is now on that platform as well, and I would actually see her in person. And that is actually at no cost to our associates. And so being able to not only see someone virtually, but also to not have a copay attached to that virtual appointment is a huge win, especially when you don't know what's happening in someone's home. And if maybe their spouse has lost their job, being able to not think about the cost of taking care of yourself is a huge win. Another thing that has been rolled out when we think about, like, I'm a parent, my daughter started kindergarten. There's been some partnerships with some businesses to ensure that parents have support, whether that is discounts on tutoring, whether that is just having speakers come in and discuss some best practices. We also are seeing a lot of programming for associates where we're talking about stress management, checking in with how people are doing, making sure that people understand that it's okay. Like, it's always been okay to not feel okay, but this is an unprecedented time to not feel okay, and what may be driving that. What are the best practices to work from home despite basically living at work at this point. So there's been a lot of programming around that. We also have seen a huge support for associates to be able to communicate when they need flexibility, especially in some of the spaces where flexibility wasn't as available. And so there's been communication from leadership that this isn't the time to necessarily not be flexible. People are at home, even if they're just answering the phones, or they're in a space where usually they have to be productive for a certain percentage of time. There's the cultural understanding that there's limitations to that when you have children running around or needs that are there to help lessen some of the anxiety that people may have of, like, if I'm not answering a call or if I'm not hitting my numbers, then what is the result? So I think that for me, even though I don't work in a production space, knowing that the culture is set that I can communicate with my manager and say, here's what I have going on. I may not be available from this time period to this time period every day because I need to make sure my 5-year-old eats lunch. That's a huge win. And I don't think people always think about the little things sometimes make a huge difference in how people show up to work and think about how they're taking care of themselves. For Gray Matter, we pivoted a lot of our programming to, one, open the door for associates to be aware of all of the many resources that Capital One offers, up to and including the opportunity to maybe step away from work if that was necessary. And one thing that we found over the past couple of months is, despite a lot of internal work that we've done to add transparency to external and internal resources, including crisis numbers, a lot of associates just are unaware of what's available. So we've made it a point to, we usually get invited to come to departments or to groups or partner with other BRGs. And we've actually made sure to create a deck, and for other businesses, it may just be typing something up or holding discussions around, here are the resources that are available, here is how they work, because that's the other component thing that we're seeing is we're rolling out resources, but we're not explaining how they work so that people can make the proper decisions for their care. A good example of that is we've always had EAP, and that has always been a huge push is EAP. And from a Gray Matter perspective, we've always pushed telehealth. And the reason being, and when we're asked, like, why, right, you're still getting care. Well, one of the things with our EAP is there's limits to the meetings, as well as the person that you see may not be able to see you after that limitation of meetings because they may only accept EAP associates. And so what happens is you really need ongoing care, and what you're being told is you've met the 5 limit max, so you have to find someone else. And that's great if you're just experiencing anxiety for the first time and you want to understand what you're going through. Not so great when you're grieving a loss or you've just been diagnosed with a mental illness and you're going to need ongoing care. So explaining the difference to people of, this is going to help you right now in the moment, and this is if you find that you are in a position where you need ongoing care, so this is a better option to consider. Having those discussions and being really in depth has opened the door for people to feel a lot more comfortable seeking care, because sometimes it's cultural, to Dr. Trenton's point. But what I'm finding, especially in this environment, is more often than not, it is the lack of understanding. And it's such a weird space if you are not familiar with mental health care. It is a weird space. There's lots of titles, counselors, therapists, psychologists, psychiatrists, and the question is, well, what is the difference and how do I know when I'm supposed to see a psychiatrist? And so having an in-depth discussion where maybe you're not saying you should see a psychiatrist because we don't do that, but saying psychiatrists are for medication management. So if you're having a conversation with your counselor or therapist and they start talking about medication, then that's the next option. And here's how you would go about finding that help. Those in-depth discussions have made a huge change for a lot of people. Instead of just saying we have the resources and here they are available. There's also confusion around our leave policies that we try to explain. Because people don't necessarily see mental illness as a disability, which it is. So that's another push that Gray Matter really has, and why we're connected directly to our disability resource group, is that it is a disability. You have the same protections, you have the same availability of resources in terms of being able to take leave if and when it's necessary, and just making sure people not only know what's available, how it works, why it's important to make sure that you understand how they work, so that you can take care of yourself. Capital One is a large place, and culturally we have changed dramatically just in the time period of me running Gray Matter. But knowing that there's job protection, just in case there is a leader who just doesn't get it, is a huge win for people, especially those who work in spaces where productivity and numbers and things like that are top of mind, and sometimes their mental health care takes a back seat if they don't know that they can prioritize it.
Thank you. Thanks, Angelique. Dr. Trenton, I have a question for you. So on this call today, we have employers that are different sizes. We may have a small business on here. We have a larger businesses on here. As leaders, we support different sizes of teams. And we're not always equipped to know the signs. And also, we don't always know how to handle the dialogue when we first run into an employee that may appear to need some sort of mental health support. It's a scary subject. So give us some tips on, how do you have the conversation, and what are the resources?
So I would say making sure that your leadership and the culture of the organization fosters inclusivity is one of the first aspects. People think of being inclusive mostly on the racial and ethnic piece of it because you can see it on the surface, or through the American Disabilities Act, because again, a lot of disabilities, you can tell, you can see it. With mental health, you can't see it unless you do know the signs and you do know what to do with it. There could be some people really, really suffering inside, but there are a lot of people who know how to put on a smile. Just like that commercial if everybody's seen that commercial on TV for one of the antidepressant drugs where they've got the little smiley face and they hold it in front of their face. I got really, really good at that. And then you get home and you're just exhausted and you don't want to be around anybody at all. And then you just unload because you're putting on a brave face for everybody during the day. So fostering an inclusive environment, even for those things that might be invisible that you don't know about. Making sure that you have a team that you've invested in, making sure that they're culturally competent and emotionally intelligent. That will help develop that environment that will allow for those types of conversations to happen. And sometimes it's just as simple as, are you doing okay today? You seem a little bit different than usual. And, it really doesn't have to be much. I can tell you from my own experience, when I was at my worst, that's all I needed to hear. When I was forcing myself to go to work, putting on that smiley face, pushing myself through the day, all I needed was one person to say, are you okay? helping with resources. I think management should definitely know what all those resources are available within that company, so that if they know somebody on their team is, and here's some things to watch for, is not quite as energetic or interactive as they normally are with the team, missing deadlines, isolating even more. And right now it's hard to tell because we're all kind of isolating, right? So if they're not as interactive, if they're a little bit slower on their work, lethargic, I'm trying to think of things you could look for right now. That's why I say it's really important to have the video meetings with people right now, and to be able to have a relationship with your team where you can take them aside afterwards, text them or call them and say, hey, I noticed you were pulling your hoodie over your face today. You don't usually do that. Is there anything going on, or are you just tired today? Because there's going to be a lot of people right now. There's a really wide spectrum of how mental illness affects people. From situational mental illness, which happens in a traumatic event, at times like COVID right now, there's a lot of people. And that's basically, when Dak Prescott came out and talked about his issues with depression and anxiety again right now, he related it to the current situation. So situational depression like that with somebody who never expected it from themselves, and it's mild, but it affects you enough to know that, like for Dak Prescott, he knew that it was affecting his leadership ability and he needed to get some help. Same thing with the leaders in our organizations and our employees. So where is that line from recognizing, I'm not feeling really great today? Well, if it's consistent, we usually say for at least 2 weeks. If there is a consistent kind of lack of motivation, lethargy, lack of interaction, isolation, things like that, then that's about the time to start thinking about either approaching somebody if you're noticing it in somebody else, or saying to yourself, and being self-aware is really important right now too, because you don't have that many people around you to ask that question to you. So encourage your employees to be self-aware and say, okay, it's been 2 weeks and I am just not getting my energy back. I am overeating, or I'm not eating, I'm sleeping too much, I can't get up in the mornings and get on my meetings and do my work. Because if you have to self-motivate, that's even more difficult when you're depressed. And it's not just depression and anxiety. If you have employees, it can be any age, that symptoms of bipolar, of schizophrenia, any other kind of psychosis that's more extreme can show itself. But if you have some staff members who are fresh out of college, the primary age range that mental illness does show itself is between 18 and 24. It's right during those college years. So if you have interns, if you have younger people, this could be a trigger for them who are predisposed. It could be genetic, it could just be because of environment, experience, or just hormonal or brain chemistry. But noticing changes in behavior are very important.
Well, thank you, Dr. Trenton. We're going to head to Q&A. So Jeff, our moderator, do we have any questions in the chat?
Thanks so much, Vanessa. I will kick us off with a question, and then we still have opportunities for you all to ask some. So if you've got some, please go ahead and place them in the chat. But the first question I have for this terrific panel is, with many of us working from home, working remotely, the boundaries of what is going on between work and home life are becoming quite blurred. Do y'all have any recommendations or strategies for how to deal with that, so that we're all not just working 24 hours a day because that's our new world these days?
I can start. I know from one of the things that I always push for is when you're in the office, you typically, not granted, we sometimes take work home, but typically you're in the office for a very specific time period. And when you go home, you dedicate yourself to home unless there's some weird deadline that you have to meet. So that doesn't have to change because we now live at work. So for me, I have a working time. I work from this time period to this time period. And then as Vanessa found out yesterday, I step away from my work phone. I don't touch it. I'm not looking at it. And the only time that I look at it is just like when I was in the office, which is right before I go to bed and see what my schedule is like for the next day, just in case I have a extremely early meeting that's before the normal time. Another thing is being able to set boundaries. So if you have a block that is for me, I have a block on my calendar that's specifically for my weekly therapy appointment. Well, when I was in the office, there was no problem with me keeping that block. People respected that. It was a block every week and they would just schedule around it. Now they see that it happens at the same time every week and they say, oh, well, this is for probably her to eat, I don't know, and they schedule over it. And for a time period, I let people do that. I don't do that anymore. I decline the meeting and say, hey, I have a block here for personal reasons. Can I propose a new time? You really have to set boundaries and ask people to respect your space. So if that is, I have lunch for this 30-minute period or this hour, let yourself have lunch during that time period. Unless there is something really pressing where you would probably skip over that if you were in the office. For me, it's just really making sure that you are setting those same boundaries, as well as ensuring that you step away. When you step away from work, you leave work at that desk, or when you close your laptop, if you don't have a desk, that work stays in that laptop. Some of the things that I know I struggle with is I think about work all the time, or things that need to get done. So I write down every single thing that I have to do that has to get done the next day, so that when I step away, I'm not thinking of the things that I have to do later, because I know that I've written it down. If I can't get to everything, that is fine, but at least I have put all of that somewhere so it's not stuck in my head and I'm not feeling the need to come back. But I would just encourage everyone to have a consistent work schedule. If you have time blocks, ask people to respect them, because otherwise you get into the habit of just stepping away, grabbing something to eat, talking to your kids, coming back, and it's just not good practice, and it's not realistic, nor is it something that you would do if you were going to work every day.
Hey, Jeff, this is Ken. I think those are great perspectives from Angelique. I'd love to hear the practical application of that from someone who works at Capital One, like a Rachel Capps or a Caleb Curtis. Do you all try to follow those same principles that Angelique just articulated?
I'll chime in, Ken. I'll be honest, I probably am not very good at that. I mean, I think being a banker and being on the development side, the business development side, it feels like we're always on. So that's something that I struggle with, and that I really have to remind myself that it's like, okay, because I feel like if somebody emails me, I want to respond back to them within the hour. I hate it if something goes, if I take half a day to respond back to them, I'm like, oh my gosh, they're going to think I'm ignoring them. And so, that is definitely from, I don't know if it's because I attribute it to being on the business development side, and then with cell phones and having email at our disposal, that is, even before COVID, that's something that I struggled with, but in this COVID environment, that's something that I continue to struggle with, maybe even a little bit more, because my office is here at home. And I'm like, well, 5 more minutes. And the next thing I know, it's been another hour that I'm sitting at my computer trying to get stuff done.
I think, Rachel, you're describing what most of us feel. in this environment. And I think that's why Jeff asked the question. But I really respect where Angelique is coming from. If we could all put that into practice, it's amazing probably how much better our mental health would be.
I'd like to add a little something to that as well. I think I'm not very good at it either. Running a small nonprofit organization, you are always on. You don't have a lot of choice in some instances. But setting routines, setting boundaries, asking people to respect those boundaries is very, very important. And I'm not very good at it. But one thing, I do have my husband here who is much better at it than I am. He is a banker and structured. He's an economist, so he's very, very structured, and he'll sit, we kind of keep each other in check. If you have somebody else there with you, he keeps me from continuing to just keep working into the evening. And something practical that we have done is we're very fortunate. We have a lake house, and we ended up moving out here and selling our Dallas house because neither of us know when we're going back to our offices. So what we do is we jump in the pontoon boat and we take that over to a restaurant where we can just park the boat at their marina, and they bring us food, and that's our commute home. We've turned that, or a walk, or something where you're literally getting outside of the house. Go for a drive. We've got motorcycles. We go for a motorcycle ride when it's cooler. Something that simulates a commute so your brain can decompress. And that has been incredibly helpful for me.
Thank you for sharing. Ken, I want to add just a couple of tips. I don't see any questions in the Q&A, so I want to add a couple things. Since you are here, you're spending time with us on a mental health topic. There are a couple things that I want you to take back to your teams because you never know when you may need it. 741-741 is a pattern on your phone that everyone should memorize. Because should you run into a coworker, a friend, a family member that needs help in a crisis, you're not expected to be the expert on mental health. But suggesting call this crisis hotline, or knowing to say call the suicide hotline, or simply saying it's okay to not feel okay. How are you doing? Those are simple things we can all do to support the mental health needs of our busy coworkers or those in our lives. And so I hope you'll take at least that back. It's okay to promote the culture of saying, I'm not okay. And here's a couple of hotlines that you could use should you ever need it to support someone.
And that's a really good point, Vanessa. And I just put in the chat, NAMI North Texas, we call our phone number a warm line. We're not a crisis center, but we do make sure that between 9 to 5, Monday through Friday, we have somebody answering the phones, just in case maybe you're not at the level of a crisis, but you're like, I'm crossing that boundary. I think I need help. I'm not quite sure where to go. I'm not comfortable doing it here at work. Call us. We'll talk through it. Or if it's, we get more calls about family members than anything else. It's a family member who's struggling.
Yeah,
we can help you figure out what to do about that.
That's great, Tina. Yeah, and Vanessa, yeah, we have multiple questions in the chat. They just came in privately. So, Jeff, why don't you go ahead and kick it off?
Yeah, thanks very much, Ken, for that. Before I do that, I did want to alert everybody to a program that's coming up on September 23rd. Our good friend Steve Love with the DFW Hospital Council couldn't be here today, but I told him I would circulate a broadcast on suicide prevention that they're hosting on September 23rd. I'm going to put a link to that in the chat, and I'll put Steve's email address there as well too. I encourage everybody to participate in that if you're interested. And I think the famous Bill Siegel has a question. So Bill, do you want to unmute and ask your question?
Sure, thank you. So it's a two-part question. First, what roadblocks do you all face from employers from employing a mental health program? And then two, how do you overcome it?
I can take that question. So starting Gray Matter was a labor of love. I held multiple conversations with HR, with senior leadership, just trying to figure out how do we start something like this? There's lots of risk and concerns around how much people disclose, if is the culture actually ready for it? And so a lot of it is getting senior leadership on board. I can tell you that I know that I work with a lot of senior leaders who indirectly or directly have mental health issues or deal with someone who does. And they are not willing to share that story or back that, and at least not until recently with the influx of COVID. I think that for me, what has worked is I have always led with the idea that taking care of your mental health is no different than any other aspect of taking care of yourself. And that as long as people feel like they are struggling alone, it will only increase the anxiety and the issues that they face. I personally had a manic episode at work before I even knew I had a mental illness. And coming back to work and not having an environment or space, I should say, where I felt like I could reach out to people who were just like me really was a struggle. And so despite people saying, hey, there's a lot of risk here and there's some legalities around if people, discuss this, there's some concerns, I felt that it was important to still move forward with making sure that there's at least associates that can connect to each other. And that's how this programming started, is as a connection group for associates. And I know that there are different sized businesses here. My point is that having all of the resources will be for naught if associates don't feel that they actually have the ability to discuss and or take care of themselves. Grey Matter is 100% associate driven. Everything that we've done has been because associates are volunteering their time. And so I think that a huge part of this is not only employing resources and not only asking senior leadership to understand, especially during a time of COVID, that there are limitations to how people can work or stressors around their mental health, but also in making sure that they understand that once we get through this pandemic, those issues are not going to go away. And ensuring that your actual associates feel comfortable that they can bring who they really are and what they're going through to work without a fear of some discrimination or just being treated differently. All of those things have to exist. And we have led a huge portion of our programming around vulnerability. So I have no problem sharing my personal story. I don't think that that's everyone can do that. But if there are people who are willing to say like, hey, this is important to me, because I would say don't silence them, because that vulnerability encourages other people in so many different ways you can't even imagine. And that has really driven a culture where when we have discussions, whether it's about grief, or recently we held a panel about even how being Black in America right now and how that feels for our associates, there was a level of vulnerability that we got a lot of comments on that just doesn't exist anywhere else in the company. And so what I know is that that has driven a lot of the work that we do and connected people and keeps them connected. So I would just encourage you all to employ the culture starting from not just from the top down, but from the bottom up as well.
Great. Thanks very much. I think we have time for one more question. Does anybody else have a last question, a short one? Ken or Bill? Bill, you had a multi-part question. Did you?
I can ask another question.
Yes, please.
What assurances does an employee have from a confidentiality standpoint in terms of disclosing that they're having mental health issues, because arguably it's affecting their performance? and you certainly don't want it to go on your file. I mean, it can be quite a bit of a paradigm in that respect. What assurances can you all have to succeed with this type of a program?
So we don't provide assurances. I will tell you the conversations that I have are twofold. If you have concerns that disclosing is going to cause you to be treated differently, put a hindrance on your career, the options that you have are through our resources, which are FMLA. Those things do not ever get disclosed outside of you actually filing the paperwork to have job protection. And I tell people, you don't have to tell your manager. You talk to your doctor, figure out what it is that you need, have them fill out the paperwork, and the only thing that your leadership is going to know is the time that you have available to take care of yourself. And that's it. That's the only conversation that you have is, hey, I have FMLA and I'm taking my time. If that is your primary concern. And so I don't ever tell people that just having to disclose what you're going through in a very specific way, and including your diagnosis, is the only option. You have options that include like not doing that, and I encourage you to use those if that's your concern. However, in my experience, and not just my personal experience, but with all of the associates that I've been able to work with over the past 3 years, having some level of transparency, even if you don't disclose your diagnosis, helps a lot in understanding. Because what your manager is seeing is maybe you're not showing up the same, or you're showing up a little differently than your peers, but being able to say like, hey, I have a medical condition that causes me, and the medicine I take causes me to run a little late. There's a level of understanding that can happen there that just wouldn't exist if you sheltered that in place because you were concerned about what they would say. So I always tell people to measure where you are in your journey. Like, I'm an open book at this point. So like, if a question asks me, we can discuss it. I'll even send you some tips of how to like manage me as a bipolar woman, if you really want to go that far. But that's my level of being open. And I encourage people who are not there to utilize the resources that are available so that they can still take the time that they need without fear that what they're actually going through is going to be an open book and it might be up for discussion. I also know at Capital One, if you are discussing something that private, they are not to share it with anyone else as your leader. So that's another thing that I discuss. Like, they're not supposed to go to another leader and say this person has a mental illness. But I understand the concern there. So I encourage people to use the resources that allow them to not actually disclose their specific diagnosis.
Thank you.
Well, thank you all very much. I think we're just past our 3 o'clock conclusion. And Bill, do you want to close us out real quick?
Yes, in that regard, gosh, these are huge issues. And quite frankly, especially with how connected we are. I think Rachel said it best, is we always have to be on, and we feel we have to be on. But I would like to thank Vanessa, Athena, and Angelique for taking the time to be with us. As a small token of our appreciation to all of this year's Middle Market Executive Forum speakers, we will make a contribution in your names to the North Texas Food Bank at the end of the Chamber's fiscal year. I want to thank everyone for logging in and listening in. Keep your eye on future Chamber programs, and this program is adjourned. Thank you all so much. I really appreciate it.
Thank you.
Thank you very much for having us
And we will
and joining.
Yeah, thank you. And we will keep the line open for networking. If anybody would like to stick around for that, we'll keep it open for 20 or 30 minutes. And I'll put in a link to our upcoming programs. But there's 2 that I want to highlight: our education forum, which is next Thursday at 8 a.m. And we've got a Civics for Business program on the 29th on the Texas Career Gap. I think both of those programs will be interesting, and they will both be virtual. So with that, we are officially adjourned, but we will keep the line open.